Good?
Yep.
All right. So today I'm going to talk about postural neurology, and we're going to talk about the different components that make up the postural system. There's 7 different components, so we're just going to run through them each, and I'll talk a little bit about those components and how they relate to posture. So let's go ahead and get started. First one is the sensory cortex, which is going to be located right here in the brain, if you guys care to know. The sensory cortex is responsible for how your body interprets the environment, as well as letting your body know where it is in space. So for example, I can close my eyes, raise my hand, and my body knows that my hand is above my head and to the right. So that's called proprioception. And so that's going to definitely be crucial for your posture, as well as letting your body know where your joint position is. Next is the motor cortex. So if your sensory cortex is telling your body where it is in space, your motor cortex is going to elicit any voluntary movements. Simple as that. The cerebellum. The cerebellum is basically your center for checks and balances of movement. It's also known as your little brain because it only makes up 10% of your brain mass, but actually has 50% of the neurons in the brain, and the cerebellum is right down here. Oh, and I forgot to tell you where the motor cortex is right in front of the sensory cortex. So that's the cerebellum. The cerebellum also is going to be responsible for filtering out any excessive movements, so it's also going to be where your fine motor skills come from. The next one is a mouthful. It's called the pontomedullary reticular formation. We're just going to call it the PMRF. The PMRF is responsible for inhibiting a flexion response. So flexion of the body would be me bending down like I'm going to touch my toes. So for posture, inhibiting that response is going to be important, so we're standing up tall and straight. I think everyone has seen someone that might have a dysfunction of the PMRF. The head starts to move forward, the shoulders roll anterior, and the person might start to develop a hyperkyphosis, which is an increased curvature in that upper thoracic spine. The visual system is next. The visual system is controlled by the optic nerve, which is your cranial nerve 1. So head posture relies heavily on the visual system by keeping that head above your shoulders and your eyes parallel to the horizon. An example would be someone that might have a unlevel pelvis. A lot of times that person will also have a lateral curvature in the spine, and that's your body's way to compensate for that unlevel pelvis. And so we can kind of right the ship and keep that head above the shoulders. The vestibular system, controlled by cranial nerve 8. And so if you remember, with the PMRF, or the pontomedullary reticular formation, is responsible for inhibiting a flexion response. The vestibular system is responsible for eliciting an extension response. So it's kind of that synergy between the flexion and extension that is going to be the goal for good posture. Number 7 is spinal pathways. So spinal pathways are going to have ascending pathways that go from body to brain, descending pathways that go from brain to body, and it's imperative that those pathways remain open and unimpeded so that all of these different components to the postural system can communicate with each other, and so that you can maintain that good posture that you're striving for. So that is the postural system. I wanted to go over next just some different testing that you can do to maybe determine whether or not there's any dysfunction in some of these systems. I'm just going to go over the first 3 systems. So the motor cortex testing would just be simple muscle testing. You're looking for muscle weakness. So let's say that we're just testing the deltoid. I have my arm out here. We push down on it. We find that there's some muscle weakness. It's a contralateral system, so that means that if I have muscle weakness on the right side, the dysfunction is on the left side of the motor cortex. And then sensory cortex testing would be just different sensation testing. So you could do light touch, you could do vibration or temperature, and you're just looking for a decrease in that sensation. So let's say that we are using light touch and we find that the person has a decrease in light touch sensation. it's also a contralateral system. So decreased sensation on the right means dysfunction on the left side of the sensory cortex. And then the cerebellar test, we use what's called Romberg's test, and that is just you having the patient stand in front of you, feet together, and have them close their eyes. Whichever direction they sway is going to be the direction of dysfunction. So the cerebellar test is not a contralateral system. So that's just some different testings that you can do if you weren't looking for a way to determine whether there's any dysfunction. So finally, to close, kind of the big question is, how does all of this relate to your health? Anytime there's postural dysfunction, there's going to elicit a fight or flight response in your body. And so what happens when there's a fight or flight response? We have increased blood pressure, we have increased heart rate, increased glucose production, a decrease in insulin production, which means that blood glucose stays high. And in the short term, and all of those things are actually detrimental to your health. So, but in the short term, probably not a bad thing, because your body is trying to kind of get you out of some situation, and then it will eventually normalize. In the long term, which postural dysfunction usually occurs over years, those types of things are going to have a very detrimental effect on your health. And so that is where that chiropractic adjustment comes back in. If we can adjust you on a regular basis and ensure that all of those components to the postural system are communicating with each other, we should be able to increase decrease your postural dysfunction, decrease that fight or flight response, and therefore increase your health. And so that's how that all ties into postural neurology and the postural system. So that's it. Hope you guys learned something, and appreciate it.